Roll call, Madam Clerk.
Amobian,
Present.
Freeman,
Here.
Baylor,
Aye.
Neal,
Here.
Holland.
Aye.
All committee members are present.
Very good. I think we may have minutes from the last meeting. May I have a motion to accept the minutes from our last meeting?
So moved. Second.
It's been moved and seconded. All in favor?
Aye. Aye.
Okay. Thank you. We don't have legislation, but we do have individuals to present to us. So I am going to turn it over to Councilwoman Mosley, who invited, I don't see Mrs. Wade. Is she on the, or is she planning to be there?
Meeting.
Oh, she's not available?
No.
Okay. Okay, make sure you tell Amy that I came down specifically to meet with her, because last time she was on the Zoom before. So let me just turn it over to Councilwoman Mosley, and she is going to lead us as she invited the guests. Thank you.
Well, thank you. Good afternoon. We have with us today, we have Amy and Nick from the ADM Board who are here today to talk about the numbers here in Summit County and in Akron as it relates to the influx in suicides and overdoses here in the city of Akron. And they do also have a presentation that they will be presenting to us as well. So I will turn it over to you, Amy and Nick.
Thank you so much, Councilwoman. And Amy Wade asked me to send her regards. Unfortunately, she had a conflict today, and so she sent me her proxy. Also with me is Nick Beckel, who's we affectionately refer to him as our data guy, and I do apologize. We are going to rely on some visuals because we're going to be looking at some numbers that I just find become a lot more digestible when you see them in context. So I am going to turn it over to Nick. If do you have the ability, Nick, to share your screen, or?
I will try. Let me see.
We can see it.
Let me
Are
see.
you all?
Yes.
Can everybody? Okay. All right, so I'll get started. If anybody needs me to stop, if you have any questions, just yell out and I'll slow down or I'll stop. So the first thing I'm going to start with is overdose. So this is the number of overdose deaths by year. Going back to being with the opiate epidemic really hit Summit County, by the way, 225 deaths. That number decreased in 27. Now, the reason for the decrease was mostly due because the primary driver behind those deaths was carfentanil. And in 2018, carfentanil kind of disappeared. In 2019, carfentanil came back, so we saw an increase. In 2020, we saw a slight increase. Again, now the drug supply changed a little bit in 2020. Carfentanil pretty much went away, but fentanyl sort of took its place. So the primary driver behind those deaths in 2020 was fentanyl. We saw an increase going into 2021 and in 2022.
Make the screen larger.
Oh yeah, sorry.
Are you on the first page or are you on another page? I see the numbers.
Yes, sorry. Let me share this again, I'm sorry.
Okay.
All right, is that big now?
Oh, yes, much better, thank you.
I apologize, I was looking at the wrong screen as I was presenting.
That's
So, anyway, kind of catch up again. So we saw an increase going into, from 2018 to 2019. We saw a slight increase in 2020. We saw another increase in 2021, and then another increase in 2022. So right now, we have 244 confirmed deaths in 2022 with another 4 pending. So that really puts us around 248, which is comparable to 2017 when we had 257 deaths. So when I present my slides to like the opiate task force, the point I try to make is if you don't remember anything, remember this screen, because what this is telling you is we are still in the opiate epidemic. Things, deaths slowed down, increase again. If we see the same percentage increase going into next year, we'll have numbers higher than 2017. Now these are in county. If we look at Akron specifically, there were 165 deaths in Akron last year of Akron residents, which make up about 67% of all those deaths. So when we compare different groups, different size populations, we look at overdose rates. Rate is the number of deaths per 100,000. And sometimes people get a little bit lost with the rates. I'm going to try and do my best to kind of work my way through them. But because they sort of mirror what you see in the number of deaths, the rates are comparable. So again, kind of saw that decrease from 2016 with things over the past 4 years slightly ticking up year after year. But what we've seen over the past few years are changing demographics. So the rate for the county is 46 per 100,000. To give you kind of a comparison for Akron by itself, the rate for the city of Akron is 86.6, which is about 40 points higher than the rate that we see for the county. If we try to compare that to other cities, the second highest city is Clinton Village, which is very small, and there was 1 death. So because the population was very small, it drove the rate up pretty high, followed by Barberton, Coventry, and Springfield. So essentially, if you look at a map of Summit County and you want to see what areas are the most impacted by overdose deaths, you're going to see Akron, and then those communities to the south and southeast. But like I said, we're seeing changing demographics. So this is the same chart, but it's broken down by race. So if you look at these charts, the green column is the rate for females, the blue column is the rate for males, and the yellow or orange line is the rate for the entire group. And this is split with African Americans on the left and Caucasians on the right. We primarily look at those two race groups because they make up about 98% of deaths. We do see other races show up from time to time. We do track those, but I typically don't present those. The important thing to take away from this is if you look at that yellow line, where it's going to have on the left side of the yellow line is the 2022 numbers for African Americans, and then the right of the yellow line is the 2016 numbers for Caucasians. You can see that the African American male rate is 116.5. That's 24, almost 25 points higher than what we saw for Caucasian males at the peak of the epidemic when we had over 300 deaths in the county. And if you just compare year to year, the rate for African American males is 52.8 points higher than it is for Caucasian males.
Nick, you want us to ask questions as we go, or you want us to wait?
Yeah, that's fine.
I guess my question is, and I don't know if you can answer this because you're not a clinician, are we finding anything comparable in terms of the involvement in treatment for African Americans, an increase or not? Do we have any data on that?
So based on like the ADM claims data that we have, we're not seeing an increase that would match this. So we're, and I don't have those numbers in front of me to give you exact details, but I can just tell you I know for sure we're not seeing, like if we were to look at a bar chart or something for African Americans receiving treatment services, it wouldn't mirror what we're seeing with these rates.
Okay. Thank you.
Yeah. So, and I guess I kind of should have walked you through this a little bit better. So if you look back at 2016, when, again, was our worst year, and going into 2017, 2018, 2019, we see those African American numbers declining. And then in 2020, we see that big jump. Again, particularly with African American males, we went from 39 to 87.4. It went from 87.4 to 94.7, which was the worst rate we've ever seen for a subgroup, if we look at different subgroups. And then it jumped again to 116.5, which again is the worst rate we've ever seen for any group. The rate for the entire, that's for males, the rate for the entire group of African Americans is 70.1, which is the worst rate we've ever seen. And so just kind of looking at African Americans in general, the rate for females, the rate for males, and the rate for the entire group are the worst numbers that we've seen. Yeah. And so because rates are difficult to understand, I try and kind of make it a little bit more easy to digest. So essentially, African American females are 1.3 times more likely to die from an overdose compared to Caucasian females. African American males are 1.8 times more likely to die from an overdose compared to Caucasians. And African Americans in general are 1.6 times more likely to die from an overdose compared to Caucasians. So then we kind of look at what is causing the deaths. And so this is called a tree graph. So essentially, the bigger the square, the more deaths we see due to a substance. And in many cases, we see multiple substances. So the biggest square is fentanyl. That makes up 79% of all overdose deaths in the county. The pink square is methamphetamine. That makes up 41% of all deaths in the county. And then the blue box is cocaine, which makes up 25% of all deaths in the county. And those percentages are comparable to Akron. If I were to just pull Akron numbers out, they're about exactly the same. But one of the things we do look at is we break those down by race as well. And so typically about 79% of all deaths, involve fentanyl. If we look just at Caucasians, about 79% of all deaths involve fentanyl. If we look at African Americans, that jumps up slightly to 80%. But that's the first time we've ever seen a percentage due to opiates compared to Caucasian. Because if you think of the opiate, typically it's something that it largely affected the Caucasian community. But we're seeing, like I said, all of those sort of changing demographics. So then, like I said earlier, usually multiple substances. So we see multiple substances listed as a cause of death. This is just kind of a quick little Venn diagram where the yellow circle is opiates, which are mostly fentanyl. The pink circle is methamphetamine, and the blue circle is cocaine. And the one that really kind of sticks out is only 43% of opiate deaths don't involve another substance. That's the first time that percentage has ever dropped below 50% this past year. So what that means really is that 57% of opiate deaths are involved either methamphetamine or cocaine. So it's the same thing with if we look at just methamphetamine, 72% of methamphetamine deaths involve either fentanyl or cocaine, and 82% of cocaine deaths involve, either fentanyl or methamphetamine as well. So then we try to look at, where in the city or where in the county, from my perspective, are we seeing deaths? So the map on the left is based on the number of deaths. The map on the right is based on the rate of death. So if we focus on that map on the left, we can see that the zip code with the highest number of deaths is 44314, which is the Kenmore area, with 25 deaths, followed by 44305, which is Goodyear Heights, part of Middlebury, with 21 deaths. Then we have 44306, which is the East Akron area, with 21 deaths. Below that is 44312. That's part of that is in the city. A lot of that is sort of the Springfield area. Below that is 44203, which is Barberton. And then 44320, which is West Akron, has 17 deaths. 12 of those were African American. And then 44301, which is South Akron, Firestone Park area, had 16 deaths. So then on the right side, when we look at the rate, which again is the impact based on the population size, the zip code with the highest impact is 44308. Now that's the downtown area. The population is very small there, and there were 2 deaths. So 2 deaths because the population is very small drives that rate really high. That's followed in by Kenmore at a rate of 132.8. Then you have the Highland Square area, 44302 with a rate of 126.7. And then followed by Elizabeth Park Valley and Shabani Hill, with both having rates, over 100. And then that South Akron Firestone Park area, the rate is 104.3. So really, we look at this 2 ways. We look at where are the who has the largest number of deaths and who is impacted the most. And essentially, if we see these zip codes, the zip codes that are at the top of either map are the ones that we really want to focus on, because those are the areas being impacted the most.
So if we look at Kenmore, that's 114, is that right? 3314?
Yeah.
If you look at those 25 individuals, what would their race and sex be of those 25 folks? Do you have that?
1 second. Sorry, I just gotta look that up really fast. Oops. So I know that 5 of those deaths would be African American. So that works out to be 20%, within the other 80% or 20 deaths being Caucasians. It's 76% female, 76% male, 24% female, which sort of matches up with what we see countywide. The average age is 48.9, slightly higher than what we see countywide. The average age we see throughout the county is about 45, 46. And the age groups are, the most of the deaths occur between 35 and 65. Are there any other questions on the overdose data before I move on to the suicide data?
I guess I know that we have IBH. I know they recently opened a satellite office in Firestone Park. I know we have other agencies as part of the system that are providing some drug treatment. Do we have numbers that would tell us where most of the folks are going? I know you have CHC, you have Oriana House, IBH are the primary providers. Am I missing one? Those are the three that come to mind.
We have a lot of providers just within the ADM system.
Right.
I couldn't tell you just sitting here, what agencies, who is receiving the largest number of people. And again, because part of that is I don't have that data right in front of me, and also we only know the data on the people we pay for. So, anybody with private insurance or Medicaid,
That's true.
it's not going to show up in my data set as far as
Right.
claims data for different agencies.
And I think, is Jennifer there? Who is there with you?
Amy.
That would know something about the budget? Does anybody?
You're talking about our Associate Director of Finance, Jen Peevitt. She is not on the call, but if there's something that I can text over to her and potentially get you some information on, I'm happy to do so.
Yeah, just curious as to the dollars. I forget what the budget is annually in terms of the dollars that are collected from the levy. If I had to go by memory, which is not very good, your annual budget from the levy is something like, is it 50 to 70 million? Is that, Am I in the ballpark? You could ask
Well,
Jim.
I could, give me just a moment, and I can actually pull up our 2022 annual report, and I can give you that number from there.
Yeah.
Would that be what you're looking for?
That would be one, and the other one would be in terms of dollars that are allocated to agencies and organizations. Do we know roughly the percentage of money we are trying to direct to these organizations to address this serious problem that we're having?
Okay, so I just want to make sure I understood your questions. So the first is how much we are, collecting annually for the levy, from the levy. And then, the amount of dollars allocated to agencies and organizations, the percentage that's being directed to addressing these issues. Did I get the second one correct? It was a little difficult to even out a little bit on me.
I think that's close enough, in terms of addressing the drug epidemic we have, obviously, in this county. What are we directing in terms of dollars to address that?
Okay, I can definitely get that information, and I will try to get it to you as quickly as possible, possibly momentarily.
Sure.
And then, Councilman Neal, I see your hand up too. I don't want you to get lost as well.
Sure.
Thank you. I appreciate that. Thank you, Amy. Thank you, Madam Chair, for the opportunity. I really appreciate this data and the way you broke it down. When we're trying to get an understanding of how we address issues like this in our community equitably, this kind of data helps. I have several questions. One, with the rise of fentanyl in the Black community, do we know, I know fentanyl is used to enhance a lot of drugs so they can hook their customers. Do we know if a lot of that is connected to marijuana laced with fentanyl, or is there a particular?
So, marijuana laced with fentanyl is really kind of a tricky issue because no one's ever really proven that it happens. We hear a lot of anecdotal. Some people say like, "Oh, I only smoked a joint and I overdosed," but we don't really see that. The bigger problem is more. There's kind of twofold. So fentanyl is in everything. So somebody may be a cocaine user and they're not aware they're using the fentanyl, and so then if something happens, they don't have that sort of background and to know to use Narcan or something like that. If there's an overdose, they may not even recognize the overdose. And the other side of that, or the other piece of that, would be someone using pills. There's most of the pills. I mean, I would hesitate to say that almost all the pills that somebody buys on the street are they're counterfeit pressed fentanyl. No matter what the pill actually says it is, if they're buying like OxyContin or something like that, it's usually going to be pressed fentanyl. Xanax is going to be pressed fentanyl. The same thing, with some of the different ecstasy pills, things like that. So a lot of it is people they're taking a substance they don't know they're taking. So I think that is part of the increase. I know Franklin County, they took a look at like a year or two ago at every pill they seized, and they found that 100% of those pills were counterfeit. And then we hear percentages from 40 to 60% of counterfeit pills contain a fatal dose. So if you're not used to an opiate and you take a counterfeit pill, 40, 60% of the time, you could potentially die from that pill.
Thank you. I appreciate that. This may sound strange or an odd way to ask this question, but are we educating, just like we know we put needles out there for people that are going to use, we make sure do we put information out there to educate people who are addicted to, opioids?
Yes, sir.
Okay.
Go ahead, I'm sorry. So I didn't mean to cut you off.
No, go ahead. I think you know where I'm going.
I do. The simple answer is yes. So for example, one of the biggest campaigns that we have been really pushing and have seen success, and I hate using that term, but success in is we've done a number of postcard campaigns directed to the hardest hit zip codes, alerting people that they can go to public health's website. It's a partnership we have with them, and they can have Narcan kits mailed directly to their homes. And for those of you who aren't aware, Narcan is the overdose drug reversal nasal spray. And it can bring someone out of an active overdose, they'll still need to present to the ER because they can go back into overdose. That's been very successful. I think in a 1 month period of time, we increased public health, Nick, was it public health request by over 700%, I think it was?
We looked at 2 to 4 month period. So there was the 4 month period of requests, and then the 4 month period during the postcard campaigns. And in the period with the postcard campaign, there was a 700% increase in Narcan requests to public health. So
Go ahead, Nick, I'm sorry.
I'm just gonna say, I think access is a big thing. The sort of the demand for Narcan is there. I think the postcard campaign showed that.
So some other things that we've been working on, we've been working closely with a lot of individuals, specifically in the African American faith community, trying to not only get reach into maybe populations that we have, struggled historically to be more active and more visible in, but also to get input, because we recognize we don't have the answer per se. We've got suggestions and we've got our data and we know, but some of it is cultural and attitudinal. And that part is really difficult. So we participated in the annual Seymour poll, which a lot of agencies here in Summit County do. And last year, one of the things that we were able to take a look at were attitudes. And we were seeing things, while it may not seem a lot, but when we're looking at 3, 4, 15% of respondents, saying things like, it shouldn't be the role of the ADM board or county to provide addiction services. Right? That also tells us that we have a cultural obstacle. Yeah. And then also, we had information, we saw things, African American men were more likely to respond that seeking help was a sign of personal weakness. So some programs, I will kind of share with you some of the things that we're working on. One of the programs that we've been looking at and working and developing relationships with is with our barbershops. Because we know that in terms of the African American community becomes another front line, especially for African American men. Again, our faith leaders have been wonderful. We have been pushing Narcan pop-ups in these, in the zip codes where we are seeing more of these overdose deaths happening. Just making things like Narcan readily available, and in addition providing additional information, whether it's some of these data points or not. If it might be resources in terms of how to get help. Those are all things, but I want to be really upfront and say we are very receptive to any possible ideas that people have, because we recognize, that there are a lot of barriers, whether it's to access, or simply by, being in the right place at the right time, or people having access to the resources they need, or how do we break down some of those cultural barriers? And certainly right now in the cultural climate we're in, I don't have an answer to that, but we're trying. So any suggestions we have, we are absolutely receptive to.
And the other thing we're learning too.
I'd love to be a part in working with some of the men's groups in my community. I know folks I talk to, one, I'm sure you probably have conversations with Steve Arrington and the Akron AIDS Collaborative. They're very active in this area. And to your point, anything I can do to help you connect with non-traditional services, this makes me think of when what was called infant mortality, now in our community we like to call it action to infant vitality. But when we were all made aware of that, credit goes to, at that time, Representative Sykes for understanding not to bring the money into the traditional institutions, because if the traditional institutions had the answer, we wouldn't have the problem. And so there was a concerted effort to find non-traditional support systems out there. And that effort has led to the growth of the Zika House and some other things. So again, thank you for this information. It's very helpful. I'd like to work with you in any way, bringing men's groups to help share this. I've got an idea for a campaign that can work. But I got one last thing. Seeing that the data is reflecting how the overdoses in the African American community spiked those when all the opioid money came in. Is there still that level of, are there still those levels of financial resources to do the same type of outreach when fentanyl and the opioid epidemic was made aware to all of us? Now that it's, per capita is still hitting the population even greater now. Do we have those resources to do the same type of intense outreach?
I can't answer for how the county is doing that, but I can answer a little more in terms of the ADM board. And I have numbers, so I want to circle back to some of those budget numbers. Okay. So when Executive Director Wade was first put into her position, what she and I did was sit down and take a hard look at where we had been focusing our attention as an agency. And in doing so, recognize that there were some marginalized populations that we had not done a very good job of doing outreach to. And as a result, for the last 2 years, we have 5 what we consider target populations. Our African American community is our number 1. Our LGBTQIA+ community, our seniors or older adults, our youth, and our immigrant population. And so we have been putting a lot of attention, and with attention I also mean financial resources as well as physical resources, making sure that we have been in what you were suggesting, non-traditional for the ADM board spaces. Making sure that we are in places where these very individuals who need this information, need these resources, need this support are. And so we have really broadened some of that physical presence as well as messaging that we've been doing. And this is kind of a bridge over to the deaths by suicide. In light of the events of July, we launched a very targeted campaign specifically for the African American community, reassuring them that it's okay to ask for help, getting messaging out about mental health resources in specific codes as well. So, we're working as quickly as we can in terms of getting information and putting our financial resources in those spaces. Amy was able to provide me the following information. For 2023's budget, $10.2 million is budgeted for SUD services, for substance use disorder services. We get a total of $35.8 million from levy funds. So 77% of our overall budget is from the levy monies. Does that answer the questions all the way around?
It gives me a better understanding. I can talk to you offline to get somewhat better educated. Thank you.
One point that I want to make. I know that peer groups, most of us are using peers to help with the problem that we have. Are there other SUD agencies that are using peers? Because, that in some cases, that is the group that's going to get to some of these individuals who need help. Those individuals they know and they've seen them do better with serious issues.
Are you talking in terms of peer recovery support type of? Right. This year we added ARC Recovery Services, who relies on heavily on peer support. I'm trying to think off the top of my head, Catholic Charities, we work very closely with David Monter and the group of peers there. Gosh, again, off the top of my head, Nick and I I'm a non-clinician, but I can certainly get you that information for an exhaustive list of who all is. Nick, are there others that you can think of off the top of your head?
You really got the ones I was thinking of. Catholic Charities with peers and the ED mainly. You know, and the other thing that I didn't really mention when we went through this was we have quick response teams that go out after somebody has an overdose. It's a team of a counselor, and somebody in law enforcement, and they go out to the houses. They try and connect people with treatment. It's largely successful. We track it by trying to see the number of people connected to treatment, and so every county, every area that does QRT, they do it slightly different. So a lot of it is information. Just, they'll meet with somebody, hand them a pamphlet, and say, we've connected them to treatment because we gave them a brochure on a treatment program, but there's no real guarantee that person has received treatment. What we do in Summit County that's different is we track through claims data if they received a service. And so what we found is through the lifetime of the quick response program, slightly over 60% of the people that received a quick response visit end up getting a billable service. So, that's a huge percentage of people getting connected to treatment, and that, again, is only looking at ADM claims data and some Medicaid claims data, so that doesn't cover anybody that doesn't have insurance. Well, I guess if they don't have insurance, they'd be ADM people, but it doesn't include private insurance, is what I meant to say. So there's a whole chunk of people we can't even check on to see if they received a service. So it's a very successful program.
I don't know, Councilwoman Mosley, I didn't even look at your direction, but I'm sure you have.
Oh, yeah. Nick, you can continue on to the suicides if you like. Oh, I'm sorry, Shamus has a,
I'm
Councilman
sorry,
Malik has a question.
Councilman Malik.
Thank you. Thank you so much for the question. I was wondering, with regard to, usually it's helpful when you break down these aspects and by other facets, is it possible to tell what people are housed?
No. We partner with the medical examiner's office, and so we get data directly from the medical examiner. So there may be cases where they say somebody is homeless, but if they find it, but I get certain data points. I get residence address, and I get address where they died, and the substances. So there may be a case where they say that they're homeless, but I wouldn't use it as a definite guide, to where I could accurately say, what percentage of people are homeless.
Okay, I appreciate it. I just, obviously there's, a link between housing and substance use and other issues, and, if we're targeting programs, it's helpful to know, but I appreciate it.
Really quick, Nick, before you move on, if you and Amy would give some thought to, I know the fentanyl test strips is law now and they're being distributed, maybe going back and doing your postcard program that you did before, letting those families who requested a Narcan kit that they now can request to have the fentanyl test strips in their home. I think that would be a great asset to combating some of this.
And certainly that's something that we're trying to get really creative. Again, there's non-traditional spaces. One of the biggest places we found interest in the fentanyl test strips was at Pride. There was a lot of interest. We gave out a lot, as well as in at the ward meeting that we were in. We were able to give out quite a few of them there as well.
Yeah.
Right now, we're kind of in a holding pattern. I know that public health is actually out of test strips because they can't, because of the Tyler Munis switch. They're waiting to be able to purchase more, but that's also something we're trying to get more actively in our community. We're working with some of the music venues. We would love to be at Blossom this summer, one of the largest music venues in the area, but also some of the smaller places. We've just entered into a partnership with, out of Cuyahoga Falls, Earthquakers. They make the custom guitar pedals, and they are donating their time and their resources to make some harm reduction videos showing how to use those test strips, and specific to be able to speak to different populations using local musicians as well. So again, we're trying to be creative, but you're right, the fentanyl test strips, now that they've been, I guess, decriminalized, people may be more comfortable having them.
Right, okay, thank you. Okay, Nick, you're up again.
All right, so this is the number of suicide deaths by year. You can see 2016 was our worst year, but then we sort of hit that 90 number, and we kind of stay there for the most part. You know, with 91, 88, 91, 92, 93, and then last year we had a pretty substantial drop. It was a 14% drop to 80. So that's the lowest number of suicides we've had in the county since 2014. So again, we look at the rates, with the green column being the rate for females, the blue column being the rate for males, and then the yellow line or the orange line being the rate for the entire county. And again, that's going to mirror what we saw with the number of deaths, is pretty much a flat line until we hit 22, where we have that slight decline. Just to give you a comparison, so the rate for the county was 14.8. The rate for the city itself, the city of Akron, was 22.1, so higher than the county, but not that sort of dramatic, disparity that we saw with the overdose rates. But again, what we're kind of seeing is changes in demographics. So these are the same charts, again, broken down by race, with African Americans on the left, Caucasians on the right. Again, I'm focusing on those two races because they make up about 95% of suicide deaths. We do track other races, but you see like a lot of years there'd just be like nothing, and then they would jump up. So we do track it and to make sure we're not missing anything, but it's just not included in this presentation. But again, so you can kind of see, if we look at the African American side, very low in 2016, kind of increased in 17, decreased in 18, decreased in 19, and then a really large jump in 2020, like we saw with the overdose deaths, with that African American male rate jumping from 9.8 in 2019 to 26.7 in 2020. It dropped slightly in 2021, still much higher than kind of what we want, but comparable to something we've seen in the past, so it wasn't quite, wasn't as troubling. 22, we had another increase, and again, the African American rate for males was 31.6. That's the second highest rate we've seen of a when we look at different subpopulations. That 2016 number for Caucasian males, where they were 35, that's the highest we've seen. So this is the second highest that we've seen. The African American male rate, and then that total rate for African Americans, which is 17, are the highest we've seen for African Americans. So while the female rate has been pretty, we don't see that dramatic up and down like we've seen with the males. It's been pretty consistent, pretty low. It's still kind of concerning that we're seeing that increase in African American males, and we're seeing that increase, for the group itself. And then if you kind of look at the city versus the county, 80% of African American suicides are Akron residents. So then again, to kind of break that down a little bit more, African American females are 0.5 times more likely to die of suicide compared to Caucasian females. That means they're less likely. If it's less than 1, it means they're less likely. African males are 1.6 times more likely to die by suicide compared to Caucasian males, and then if the entire population, African are 2 times more likely to die by suicide compared to Caucasians. And that's pretty much the breakdown of the suicide data. With the overdose data, we do a lot of stuff with Matt to look to see where we see like hot spots and things like that. We do track locations for suicide data, but suicides are largely kind of spread out. So I don't have any maps prepared for the suicide data, but I am available for questions if you have any questions.
You know, this seems to coincide with the pandemic as well. I recently read an article where they talked about African Americans in some of these major cities feeling so lonely. And, you know, that's clearly some of the signs of, you know, depression and, you know, isolating yourself. And then with the pandemic, it just created, you know, the so-called perfect storm when everybody was kind of isolating because of that, the virus. And you see in 2020, because I think the shutdown started like the latter part of 2019, 2020, and those numbers kind of shot up. And
yeah, and the suicide data, in my mind as a data person, is harder to categorize because like with overdose deaths, like, you know, I have buckets that things can fit in as far as, you know, substances that cause the death, where with suicides, we try and find trends, like did they have previous attempts, were they currently in, you know, treatment for mental health services, but you see also when things pop up, so stuff like that, did they have a diagnosed mental health issue, they don't have a diagnosed mental health issue, they never say they were depressed, then you have things like breakup, you know, divorce, legal issues, financial issues, there's so many things that it's hard to, you know, from my perspective, put things in a bucket and tell you, hey, we saw an increase in this in 2020 that led to the increase in suicides because it's just not there in the data, you know.
well, anyways, it's good to know that you're reaching out to different and trying to help because it is a problem. It's very difficult to put our arms around and find, you know, a silver bullet. But to know that because I know a lot of African-American churches, I know my church talks a lot about getting help through counseling and other services. And it needs to be continually reminded through all those organizations that it's not a sign of weakness to get help. I mean, it's a sign of strength if you reach out and do something about a problem you have. So, thank you so much, Councilwoman Mosley. Are there other questions, comments?
I just want to let everyone know we kind of condensed this information down into a one-page summary. We sent it to Councilwoman Mosley, so that should be available to you. But I would also put the pitch out there that we are very happy to come to your ward meetings. We are happy to come to your places of worship. We are looking for individuals who can say, you know what, I have a friend who owns a business would be happy to let you put a pop-up in their parking lot and get Narcan out. We need our community to help us reach these individuals, and we are doing everything in our power to let people know we want to be in those places where people need us. And so if there's an opportunity that you think we would benefit from being in, please feel free to reach out to me, to Amy. She will get that information over to me. Or, you know, if you have ideas, if you see something that you think could be beneficial, maybe you're traveling and you see another town or a city with a message that looks like it could be beneficial to our population, please. We are receptive to all those things, and I want to hear from our community on ways to help.
And also, I wanted to add that since the councilwoman invited us out to her Ward 5 meeting, we weren't really looking at stuff by ward prior to that meeting, and so now we are. And so, at least with the 2022 data, we have all this available. We can break it down by ward. So if you wanted to see things specific to your ward, you know, I can make that available too.
Oh, that's good to know. Thanks. I appreciate you all for doing that. I know that's one of the questions that came up at the ward meeting about the breakdown per ward, so I appreciate that. And again, thank you for taking the time to be here to discuss these numbers with us. I'm sure most of my colleagues will reach out to you to have some meetings within their ward. I think it's very important that the residents know that we have an issue that needs to be addressed, and maybe even help someone along the way. So I thank you all. Anyone else have any questions? Councilman Mallett?
Thank you. I guess just one question. When we're looking at both suicide and overdose data, are we seeing trends with regard to age? Like, is this primarily young people? Is it fairly distributed across age ranges?
It's older.
So I can tell you, we're seeing with overdose deaths, we're seeing the age kind of slightly increase. It was, the average was like around 40, 41 for a few years, and essentially when we saw this increase in the African American community, they tend to be older, and so the average age has kind of gone up to around 45, 46. So that's sort of what we're seeing in the with the overdoses. And I can tell you really quick with suicide data, not particularly seeing many changes. It kind of, it's still just kind of that core group of, you know, like that 35 to 65 sort of is where we see the most. We do see, you know, maybe year to year, like there might be some differences that kind of pop up one year, but they go away the next year, but nothing that's like really trending to where we would say like, okay, we're definitely seeing this change. But we are seeing that change with overdose deaths.
Thank you. I really appreciate that.
And also, if you go to the ADM board's website, we have our live data. You can, it's right there on our front page, which is we're about to get into a new website to make this even easier to get information to individuals, but we do have our dashboards available so that you can go and look at this information, and correct me if I'm wrong, you can even break it down by demographic, by age, whether it's the overdose information or the deaths by suicide. You can look at it by race, by year, so that information is available on our dashboards as well.
Yeah, so we have a suicide dashboard, an overdose dashboard, and then a kind of a more detailed, there's a dashboard for the opiate task force presentation. They're all public facing though, so they are kind of real high level. So if like, for example, like if there's like with zip code data, we don't share anything that has fewer than 10 deaths. So, and then again, it's just for confidentiality, but we do have that available. So if you'd like, you know, to see some of the data like that I went over today, where, you know, it's more detailed, I'm always available to provide that. But if you just need some quick numbers to see where we are compared to, you know, year to year, like Amy said, that's available on our dashboards.
All right, well, thank you. Does anyone else have any questions?
Thank you very much.
I'll turn it over to you, Councilwoman Amobian.
Councilwoman Mosley. Are there any other comments or questions? Hearing none, thank you so much for the presentation. And tell Amy I made a special trip here just for her. But thanks a lot.
I will let her know. And again, well, very, you know, sobering. We do appreciate the opportunity to present this information and to inform you in any way that we possibly can. So thank you again for the option to be here. We appreciate it, and we're always, you know, welcome to get you any information you might need. So don't hesitate to reach out.
Yeah. Well, thanks for the info and thanks for your work. We really appreciate it.
Thank you all so much. Take care and have a good week.
You too.
Do the same.
Nothing else coming before the committee. We are adjourned.
That is the final committee meeting today. Council will meet at 7 p.m. tonight. Thank you.